Have you ever noticed an unexpected bump or growth, perhaps thinking it is just a minor skin irritation? Sometimes, these seemingly small issues can point to a more common viral cause. Genital warts are primarily caused by certain types of the human papillomavirus, or HPV. This common viral infection is sexually transmitted and can lead to growths on or around the genitals and anus. HPV is a group of over 200 related viruses, but only about 40 types affect the genital area. Specifically, low-risk HPV types are responsible for most genital warts. The most common culprits are HPV type 6 and HPV type 11, which together cause about 90% of all genital wart cases. These viruses infect the skin cells, causing them to multiply rapidly and from visible warts. High-risk HPV types, while they usually do not cause warts, are linked to certain cancers, including cervical, anal, and some head and neck cancers. It is important to know that a different strain of HPV causes those cancers than the strains that cause warts. The virus needs direct skin-to-skin contact, typically during sexual activity, to spread from one person to another. Once the virus enters the body through tiny breaks in the skin, it can lie dormant for weeks, months, or even years before warts appear, or it might never cause visible symptoms at all. To reduce your risk of getting or spreading HPV and genital warts, consider vaccination, which is highly effective against the most common wart-causing types. Practicing safer sex by consistently using condoms can also help, although condoms do not cover all exposed skin. If you notice any unusual growths, it is important to see a healthcare professional for an accurate diagnosis and discussion of treatment options. They can confirm if it is a wart and recommend appropriate next steps. Did you know that HPV is so common that almost every sexually active person will get at least one type of HPV at some point in their life if they do not get vaccinated? Many HPV infections clear up on their own without causing any symptoms, which is why it is often called a silent infection. However, for those persistent infections, the HPV types specifically linked to warts are generally not the same ones that cause cancer, offering some reassurance. Understanding that HPV is the underlying cause of genital warts empowers you to make informed decisions about your sexual health, from vaccination to regular checkups. Knowing how the virus operates and how to protect yourself is a key step in safeguarding your well-being.